I'm Dr. Steve Fawcett. I'm a GP in Stoke-on-Trent. I'm also the medical director for the local CCGs, which I've done for a few years now. I've been a GP in the city for 25 years plus. And what I really wanted to talk to you about was how we've tried to help elective referral pathways to try and make them better for the patients, but actually make them better for the GPs as well. So we really introduced the integrated MSK pathways because of increasing delays within the system, because a lot of the activity was taking place in the wrong place, so it wasn't the right patient at the right time, if you like. The services were becoming increasingly complicated for patients to navigate, for the GPs to navigate, and rolling it into an integrated single solution meant that a lot of that uncertainty was taken away. And also because colleagues were asking for some simplification of how the systems will work and how they'd get the best out of those services. So an integrated MSK service seemed the right way to go. Using an MSK, an integrated MSK service for practices has a number of benefits. Probably the most obvious one is taking some of the administrative burden off practices, because when a patient comes in with a musculo-skeletal problem that needs input from outside the practice, we currently have to go delving into choose and book or e-referrals as it is now, and then we have to start managing choice for the patients. Now that might either be the clinician or one of your administrative team, but nevertheless that is a burden that you could do without. Having the integrated service means that we can refer into an MSK pathway, and if they need a particular intervention, for example an operation or some other intervention, the service will manage that themselves. So they refer back to our choice and referral centre, who manage that all for them. So for the patient it seems seamless. For the GPs it's a bit fire and forget. You've done your piece of work, you've got the patient on the right pathway, you don't need to fret about it anymore. In terms of quality and in terms of clinical sovereignty, if you like, all the triages, all the referrals are triaged, and then there's an assessment where they go. Where sometimes there isn't enough information, the triage service could potentially contact the GP, but in my experience that happens incredibly rarely, and patients find it much easier, and they're not ringing the practice back asking for updates or where am I in the system. The MSK services manages that for them, and generally also gives them a degree of open access when they're actually in the pathway, which means that when you're on a Monday morning triage surgery, you're not getting calls from patients saying, when's my appointment for my shoulder procedure? The service manages that for them. The advantage for patients are that they get a rapid assessment by an appropriate clinician. And that can't be understated, because if you refer to orthopaedics, generally you'll be waiting 16 to 18 weeks and then you'll have the assessment and so forth, certainly locally. Whereas with an MSK triage type service, you'll generally see a consultant physio within about a week to 10 days, and then we'll get put through to the other parts of the pathway that you need. Now for somebody with, for example, we had a patient who was a bricklayer the other day, who's got shoulder problems, and shoulder problems can sometimes be quite complex. When we refer into the MSK service, they will get an assessment by a consultant physio or some other appropriate physician, and then they get the diagnostics really quickly. So generally speaking, they'll have an ultrasound and a plain film of their shoulder, usually within a few days, sometimes on the spot. Now compare that to the pathway that the GPs have. If I start the investigations at practice, what will happen is that then I'll send off an ultrasound, which may take 4 weeks to happen. The x-ray will be fairly quick. Then we say, oh look, they've got bursitis, they need something doing to them. Actually, we then have to arrange that. Now I could possibly inject it in practice, but it's quicker to go through the MSK, so it runs really quickly. The other bit is that they're getting an expert opinion, and they've got consultants embedded within the service. So if they need, somebody more expert and somebody more specialised, that's available to them. But the beauty is for the consultants, they're just seeing the patients they need to see, not everybody. So the ones who really need it get access to the expertise, and the ones that can be dealt with in different ways are dealt with differently. And because it's a single point of contact for them, there's much less hassle in terms of arranging follow-up or understanding where their appointments are. They don't have to ring lots of different services. There's a single number they ring and that's it.